Scientists in Switzerland have now developed a vaccine that could greatly help people with cat allergies. Dr. Richard Chaffoo is here explaining why the vaccine is for the cat and not for the person who's allergic.
Exactly.
Good morning,
Good
Doctor.
morning, Raoul.
Okay, what is this vaccine?
So the vaccine was developed by a Swiss company. It's called HypoCat, and it's a series of injections that are given to a cat.
Oh, it's to the cat.
To the cat, not to the human. You know, a lot of the shots that have been given to adults don't seem to work all that well, and 10% of Americans are actually allergic to cats. And so this was a reaction to something that just doesn't seem to work. And what happens, Raoul, is the cat is given the injections, and the cat develops antibodies, which are proteins that will bind and neutralize the allergen that they shed in their saliva and skin, and therefore reduces our exposure to this allergen and makes it, we have much less symptoms associated with that.
And I know there was a study done, but are there long-term effects to the cat itself?
Exactly. So there's no evidence that there are any adverse effects. It's a series of shots that are given, 3 shots over about 9 weeks, maybe a booster about 6 months. The only reaction, some of the cats were a little sore for a short time, which you would expect with an injection, but no real severe consequences.
So what happens next? Is this readily available?
So
when will it be?
Probably about 2022. And there's also a new one called Hypo Dog that's being developed for people that have allergies to dogs.
I mean, this could revolutionize
it could certainly make a huge difference. Instead of having to give your cat away if you have an allergy, this really can make a big difference for people.
Okay, in other news, and we were just talking about this during the break, there's a new study linking fluoride consumption during pregnancy with lower childhood IQs. This kind of blew my mind. I was asking you, is this just from brushing your teeth with toothpaste? Explain what this is all about.
So it's a fascinating study. You know, we've had fluoride in our water system since the 50s to reduce tooth decay. And so there's always been concern, well, does fluoride have some detrimental effects? And so this study that was funded by the US and Canadian governments looked at 600 pregnant women and evaluated their fluoride levels by urinary tests during pregnancy, and then they looked at their children at the age of 3 to 4 and did IQ testing. They found in those women who had higher levels of fluoride above an additional milligram per liter, the boys in that study had lower IQs by 3 to 4 points. Now the interesting thing is they didn't find those same results in the girls, and the study didn't really document or look at specifically what the cause and effect relationship was. The important thing I think for people to remember, excuse me, is that the fluoride concentrations that we have in drinking water is relatively low. It's 0.7 milligrams per liter. This is for higher doses, and most of the fluoride that we actually get comes from our food and also the toothpaste.
Food?
Yes. So coffee, tea, raisins, grapes, potatoes, shellfish, sweeteners, sodas, all those things are where we get most of our fluoride from.
Sure. The level of concern, if you're woman's pregnant now, I mean, how worried should I not brush my teeth? I mean, what's the message, the takeaway?
The best takeaway is, you know, take this in consideration. It's a small study, but certainly there's no evidence, Raoul, that fluoride has any beneficial effects for women during pregnancy. And so if a woman, of course, is pregnant, you want to be cognizant of the fact that maybe maintaining your iodide concentrations as low as possible, not overeating foods that are high in fluoride.
And maintaining all those levels is critical during pregnancy, obviously. You can still brush your teeth, but maybe not
smaller amounts.
Smaller amount?
Exactly.
It actually does have to do with that.
There is. A study was done in 2012, and they looked at fluorosis, which is a cosmetic discoloration of the teeth in teenagers, and that was all due to the fluoride in the toothpaste from over-brushing. So we know there are some negative effects as well.
And I wonder even though it's a small study, I'm curious as to why it only affected boys and not girls.
And that's a question that the scientists were unable to answer from that study. So more studies, as you say, are needed to be done. You know, science is constantly evolving. We need to look at further studies to make some definitive decisions.
It's fascinating stuff.
It's very interesting.
All right, Dr. Richard Chaffoo, we thank you as always.
Thanks, Raoul.
All right.